we're going to release internal obliques. So this time I'm going to use the hip bone. Lift your arm for just a second. There you go. I'm going to bring the hip bone up toward the linea alba and toward the bottom of the opposite rib cage. So we're going diagonally. Okay? Notice I am monitoring on the same side of the body. I'm using the sheet to do this. You don't have to use the sheet. You can reach underneath the sheet, take the hip, bring it up toward the bottom of the opposite side rib cage. We go back and repalpate. Our second release for internal obliques is we're going to use the floating ribs. So I'm going to dive my hand underneath her body. I'm going to bring those ribs lateral and then twist them up toward the diaphragm. Now this sounds odd since they're at the bottom of the diaphragm. So let's say up toward the xiphoid process. So you're arcing the lower rib cage all the way up like this. Of course, you'll never make that, nor should we make that. This is a great release. This will release the backside of the diaphragm as well. Internal obliques, lats, serratus posterior, inferior. You get a lot of muscles tied into this. Okay, and you can see that I'm getting a lot more depth. Notice that as I come down into the pelvic area, my strokes are coming up toward the belly button. So I'm really pulling up from the bottom toward the belly button. This elongates the ligaments, and elongates the tissue. So it really helps open up the pelvis, open up that pelvic area. There are a lot of organs in there. We want everything to be buoyant, to be movable. Tends to be quite a bit of adhesion in here as well. So the more you pull up toward the belly button, the more open you're going to make that space. This will help women with their cycle, if they're getting cramps. This will help after having a baby. Tends to help swelling of the prostate. Swelling of the prostate, inflammation of the prostate tends to sit on the left for men, whereas uterine issues tend to be more to the right. Not always, but that is the tendency. So in both cases, you want to come up from the bottom toward the belly button.